5 minutes after 9 o'clock. Thank you for tuning in. It is time for our medical correspondent, Bern Paraiso, to be on the air with us to tell us what's going on out there in the world of medicine and health and all of that. And she's not in the studio today. She's on the phone, so I'm a little disappointed. I always like when pretty ladies are in the studio.
Yeah.
I like that. It's
They're
just
pretty and they smell great.
Good morning, Bern. How you doing?
Very well, Larry. How are you doing, and Robin out there?
Pretty good. Where are you today?
I am actually live at Central Florida Endoscopy and Surgical Institute here with Dr. Vishnu Reddy. He's actually busy doing the colonoscopy.
He's doing one right now?
He is doing it right now, but I am not able to access the operating room. I'm actually out here, outside, and I'm inside the booth of the gastroenterology supervisor's office.
Oh.
I am watching you. I can see you and Robin.
Oh, you can see me. Hi, let me wave. Hi. It'll probably be delayed a little bit. So, what kind of information are we going to learn about today? What?
Well, okay. I know that last week we were discussing about the importance of colonoscopy, and we went over the instrument that's being used, and it's called colonoscope. And I hope that we were able to help our listeners to understand about how important it is to get this called colorectal cancer screening. So anyway, we had one question that we are supposed to answer, and the answer is actually from Dr. Vishnu Reddy, since he is the medical director. And you raised that question. It is colonoscopy screening for men and women?
Okay. And what did he say?
And the answer is yes, absolutely. So this is not, just for men or just strictly for women. It is for both.
Okay. So, have you had yours?
I need to get it done, Larry. And
Me too. I have never had this done.
We all need it.
Is it uncomfortable? I mean, is it embarrassing? What exactly is involved?
There you go. That would be for our next discussion about how the prep is being done and what everyone is supposed to feel.
Is there an age that it should be done, like anybody over 30 or anybody over 40, that type of thing?
Okay, well, Dr. Reddy was saying that in general, it's 50 years old and older, but if you have a history in your family, you must get it at the age of 40.
Oh, okay.
Now, what is, I guess, the best news after and we call it an endoscopy? That's what we call it?
Oh, yes. It's, the EGD is, it's, there's two tests that can be done. We can do the upper and the lower, but we are discussing about the colonoscopy, which is the colorectal cancer screening, yeah.
Okay.
But we will get there because actually, and that is a very good question there. Last week, there was a patient that was complaining of, and this is interesting, hiccups. Now, have you had hiccups, Larry or Robin?
I have, but not down there. No.
And this is a 42-year-old beautiful woman, and, she was referred by her medical provider.
Yeah.
And then EGD was being done. And guess what happened? There was no other symptoms other than hiccups, and what the patient was complaining that every time she would go out and eat, the hiccups, it's like off and on, and she would stop eating. Because, it's how discomfort it is.
Right.
And then what happened is she decided to seek a referral from her family doctor, and she was referred to right here, the Central Florida Endoscopy. So EGD was performed, and the diagnosis, and this was released by Dr. Reddy, is a grade 4 severe ulcer, and it is called esophagitis. Can you believe that?
Oh,
and they discovered that with one of these colonoscopy?
The EGD, which we will be discussing next week, is the procedure. It's an upper procedure that's being done, but how neat that can be. And, think about 2 years she was complaining about this, the hiccups. No other,
Wow.
nothing. No stomach ache. Yes, no abdominal pain.
But they figured it out, and she's okay. I mean, it's no.
She is on medications
Okay.
now, but why do we have to wait and suffer? Where we know that there is really a solution to all these.
We used to hear that ulcers were caused by worry and things like that, and then I was reading a report not too long ago that they're actually caused by bacteria. So I'm guessing that's probably what we now know, and compared to what we once thought, right?
Mm-hmm.
Exactly. But you know how it is when we have a stomach cramps or maybe abdominal pain. We go to the pharmacy and take an over-the-counter. I would not advise that because Dr. Reddy was saying it's best to communicate with your family doctor and tell exactly what you are going through, and especially if it is like occasional. I mean, if it's occasional, still you don't want to take it for granted. Go see your doctor.
So if a person feels that they need to have this done, can they just make an appointment with Dr. Reddy's office, or do they need to have a referral from their family practitioner?
That is correct. The second one is correct. You have to go see your family care provider, and they would give you a referral to see a doctor, and then the specialist or the gastroenterologist would schedule you to get this test.
So I wonder what the percentages are. How many people come in, and is it like most people come out with a clean bill of health, or is it half people go in and get this colonoscopy or any of these tests and have something that needs to be treated? I wonder what the numbers are.
That's actually another discussion. We are going to be talking about the symptoms, and Dr. Reddy just released the information. But basically, it's when you experience like abdominal pain, upper and lower, and sometimes I cannot release a lot of the medical terms.
Okay.
Doctor, but we can help our community by encouraging them to get a colon screening or anything that is in the stomach, matters. Sometimes you think it's a chest pain. Well, you go see your cardiologist, but
right.
then the EKG would, the result is negative. So I think it's, gastroenterologist would always ask the patient to ask for, or the doctor. Your doctor would recommend you to, go to your gastroenterologist, a GI doctor, to get a colonoscopy, which is good, or EGD. So 2 different tests.
So when a woman goes for her yearly physical and then they refer her to get her yearly mammogram, she should also get this done then. That should just be part of the routine.
Exactly. And like I said, that's why I always encourage, every person that I would meet that get screened, especially if you have an insurance,
Mm-hmm.
And I know it can be a problem when you do not have a coverage.
Yes.
But still, we can get it done. So anyway, screening is really important, and, people stay well, and it can save lives as well because it helps. Any kind of screening. So 50 years old and older, I'm actually about there, so I will need one done for myself.
Really?
So Larry, we need to get it done. And how about Rob?
Are we going to do it together? Wow. I don't have very many women inviting me to do stuff. I might want to take her up on this.
Yeah, he'll bring the snacks.
Yeah. I haven't been invited to do something in a long time by a woman. This is the first. Wow. I gotta go buy a new shirt.
But listen, I know that it's almost 9:15 here. I just want you to know that it's a beautiful day. And before I signed off, I want to thank all our medical providers, especially here in Marion County. Thank you for doing a wonderful job to our community. And, I'm sure if you come along with me with my mission, it's one patient at a time. Your health, I care. For those of you that would like to get your screening done, by the way, Dr. Vishnu Reddy, he is the medical provider at Seven Hill Gastroenterology. Location is 3256 South Pine Avenue. This is South Highway 441, and it is in Ocala. Telephone number 401-1919, or you can email me at Bern@gfamedicalmarketing.com. It's 9:15, Larry. I'm Bernadette Paraiso, your medical reporter.
Okay, thank you so much, Bern. That was great. We'll talk to you.
You're welcome.
Call anytime. Let me know when we're going to go out to that thing.
Absolutely.
All right.
Thank you, Larry.
All right,
Thank you, Robin.
thank you, Bern.
Thank you, Bern.
All right, we'll take a little break and we'll be right back.
This is Salvation Army,
you.
and I'm Major George Patterson to let you know that the Salvation Army is available 24 hours a day to provide help to anyone. We also have a family store at 120 Northwest 10th Street in Ocala. On Tuesday to Saturday from 9 to 4, you can do your shopping, or if you want to donate, you can call 352-732-4469, and we'll even pick up 352-732-4469. All funds generated by our store go into the programs here in Marion County to help the needy.